Hi everybody, my name is Dr. Malvika. Today we're going to be talking about how to develop your CV as a medical student or a graduate doctor in order to get your first job in the UK. This is specifically for FY2 and other specialty training jobs that you'll be applying to in the future. And so if you start developing your CV early, you'll have an advantage of everybody else. The UK has a specific checklist that they use in order to grade your CV. And they always stick to this checklist. The checklist is the same for all the jobs in the UK. But the only one that's been released is the self-guidance and portfolio guidance for candidates of surgical training. Use this as a guide in order to get your CV ready for any job that you're applying for in the UK. I will link this document below as well as put up a website link on the screen right now where you can go and find this document and score yourself according to the document and see how strong your CV is. So basically you'll see that the things that the UK likes to focus on is one, your medical degree. So any degrees that you have on top of your medical degree, like a BSc or a intercalated BSc or a PhD, that gets you extra points. The next thing that will get you points is doing a CPD course. A CPD course is basically continuing professional development, and these courses should be done in specifically the field that you're wanting to go into. So for surgery, the more courses you do, the more points you get. The next scoring category is for additional achievements. So if you've gotten a scholarship or if you've gotten an award like the PEDS award or the Obs and Gynae award, or if you've gotten an honors degree, there's specific details about it, but these can get you extra points when calculating your CV score. The next category is quality improvement or clinical audits. So depending on if you've done a regional, national, or international clinical audit and how involved you were in the clinical audit, you can get points, you can score well on that. The next thing that they really like is teaching experience. So when you're applying for these jobs, you can talk about your teaching experience. If you're a PAL tutor in university, that's great. Or you can do OSCE teachings for juniors, you can do OSCE teachings for your own class and get someone to fill out a teaching form for you guys. And that will really help in your portfolio. The next thing they also really like is training in teaching. So you can do an online course for training in teaching and get good points, or you can also do an in-person course for training in teaching, and that will get you up to 4 points. The next thing they really like is oral presentations. So you could do the clinical audit or your systematic review and then do an oral presentation at a conference at a regional or national level, and that will get you 4 extra points or up to 6 extra points, but you only did one project. So that's a really good way to score up on points. So if you have any research or any audits, then make sure that you present them at some meeting so you can get points for the presentation as well as the audit or the research. So specifically, if you want to get points for a publication, your research must have a PubMed ID. Without a PubMed ID, your research doesn't count. They don't care. Get a PubMed ID. Then they really like leadership and management skills. A great way to develop leadership or management skills is by heading a club or society in your university. It's an example of holding a local leadership or managerial role. You could also be the vice president or the secretary, and that also counts for leadership and management. A great way to build your CV is through these medical societies and surgical societies in your university. So I would highly recommend that you join your research society or your surgical society, or if your school doesn't have one, you can make the society, which is even better. You get points for leadership, you get points for the research and the surgical material that you actually conduct. So I would highly recommend that if you don't have one, you make a society. Other things that they like to see are commitment to either surgery or medicine or whatever you're wanting to go into. So electives, but it doesn't really matter if you do the elective in the UK or anywhere else. Doing or booking your MRCS, doing a surgical clinical audit or a surgical research, or attending conferences, specifically surgical conferences. I'm saying this all for surgery because I have the surgery portfolio in front of me. Just adapt this to whichever specialty you're looking to go into. And then they talk about clinical procedural experience, which will be basically making a good logbook and maintaining a good logbook for surgery and references.